All right, today we are diving deep into the official playbook for classifying a human medicinal product in Saudi Arabia. Now, look, if you work in regulatory affairs or pharma strategy for the kingdom, you already know this is so much more than just paperwork. This one decision, this classification, can literally make or break your product's entire life cycle. So let's break down the Saudi Food and Drug Authority's framework, piece by critical piece.
And at the very heart of this whole process, you've got the SFDA. Their mission couldn't be clearer: to protect public health by making sure every single drug is safe, high quality, and effective. They are the gatekeepers. They decide exactly how patients will get access to your product. So understanding their thinking isn't just helpful, it's absolutely essential for a successful launch. And that brings us to the biggest question every single applicant has to answer. Is your product going to need a doctor's prescription, or can a patient just walk in and buy it themselves? This single choice, prescription only versus over-the-counter, it dictates your entire go-to-market strategy, your patient access model, and let's be honest, your bottom line. So how in the world does the SFDA make this crucial call?
Well, that's what we're here to find out. We're going to walk through 6 key areas. First, we'll lay the groundwork with a classification framework and the 3 legal classes you just have to know. Then we'll get into the weeds of the critical POM test that decides prescription status. After that, it's all about the practical stuff: submission, distribution, the strategic path to reclassification, and we'll wrap it all up with a handy regulatory checklist. Okay, Section 1, the classification framework. The SFDA's system is, you'll be happy to hear, actually pretty logical. It all comes down to 2 main pillars that answer 2 really simple questions. How can a patient get this medicine, and where can they get it? And here's the difference, and it's a big one. The legal status is all about the how. Does the patient need a permission slip from their doctor, or can they make the choice on their own? The distribution status, on the other hand, is the where. Are we talking about a specialized hospital drug, something for any local pharmacy, or could it even sit on a supermarket shelf? You have to propose both in your application, and the SFDA looks at them together. All right, moving on to Section 2. Let's get these core categories down cold, because they are the absolute foundation of that legal status decision. There are 3 of them, and if you work in this space in the kingdom, you need to know them inside and out. First up, the one we're all familiar with, prescription-only medicine, or POM. This is pretty much the default for many new products. It's simple. A licensed physician is the gatekeeper. They make the call, they write the prescription, and the patient takes it to the pharmacy. End of story. Next, we have over-the-counter, or OTC. This is where the patient is in the driver's seat. They can self-select and buy the product directly. Now, the SFDA is really clear on this. This isn't for your vitamins or herbal supplements. They have their own set of rules. We're talking about established medicines with a safety profile that is so well known and so solid that letting patients have direct access is considered safe. And the third class is controlled prescription medicines. Now, these are in a league of their own. These products contain substances that are governed by super strict laws for narcotics and psychotropics. They have a whole separate and much more demanding set of regulations and controls that go way beyond what's required for a standard POM. We won't go too deep here, but you have to know this high-security path exists. Okay, Section 3. And listen up, because this is probably the most important part of the whole framework, the prescription-only test. The rule here is incredibly simple and totally unforgiving. If your product checks any single one of the boxes we're about to go through, it is automatically classified as a POM. It's not a negotiation. 1 yes on this checklist, and you're in the prescription-only category. Period. So the first batch of criteria is all about risk and supervision. First, does the medicine pose any kind of danger, even when used correctly, if a doctor isn't watching? Second, does it have a history of causing serious side effects or bad interactions? And third, is it administered parenterally? Meaning, is it an injection or an infusion? If you need a healthcare professional just to get the drug into the body, well, it's a POM. It's as simple as that. Now, this next set of criteria shifts from the drug itself to how the patient might use or misuse it. Is this a product that people often use the wrong way, creating a potential health risk? Is it for a condition that's really hard for a regular person to diagnose correctly, maybe causing them to delay seeing a doctor for something serious? Or, and this is a big one for new drugs, does it contain a new substance where we just don't have enough long-term data yet? If the answer is yes to any of these, the SFDA wants a doctor in the loop. It's a POM. So, we know the rules of the game. Let's get into Section 4 and see how to actually play it. How do you take all this theory and turn it into an official SFDA-approved classification for your product? The process is actually very straightforward. As you're putting together your Electronic Common Technical Document, your ECTD dossier, it's on you, the applicant, to make the first move. You have to formally propose both the legal status, POM or OTC, and the distribution status. And you don't hide this deep in the file. You put it right up front, in Module 1 of the application. Your entire dossier then becomes the argument to back up that claim. And this table shows you the where part of the equation perfectly. I mean, it's no surprise that hospitals and community pharmacies are set up to handle all three classes of medicine, right? But check out that third channel, food retail stores. Access there is incredibly restricted. It's reserved for a very specific, approved list of OTC products that the SFDA has deemed safe enough for that kind of environment. Getting your product on that list is a huge regulatory win. Now for Section 5. You know, for a lot of products, the story doesn't just end with that initial classification. There's a really interesting strategic pathway called reclassification, and the most famous version of this is the POM to OTC switch. The goal here is a big one, but it's incredibly valuable. You're trying to take a product that has spent years needing a doctor's sign-off and make it directly available on the shelf. This isn't just some small regulatory tweak. It's a complete commercial transformation. And to do it, you need an absolute mountain of post-market safety data and real-world evidence to prove the risk is now so well understood that this switch is safe for the public. And the bar for this is, as you can imagine, very high. First off, your product now has to completely fail that POM test we talked about. It can't meet a single one of those criteria. On top of that, it needs to have a huge margin of safety. The condition it treats has to be something people can reliably diagnose themselves. Think a common cold, not a complex cardiac issue. The risk of misuse has to be tiny, and the instructions have to be super simple. The burden of proof is 100% on you, and it's a major undertaking. Okay, that brings us to our final section, number 6, a practical checklist. Because whether you're going for a brand new OTC approval or that strategic POM to OTC switch, let me tell you, your documentation, your paperwork is everything. Let's kick things off with the SPC, the Summary of Product Characteristics. Think of this as the technical manual for healthcare professionals. There can be zero, and I mean zero, ambiguity in your warnings. No wishy-washy language. Every single piece of information has to perfectly support the legal status you're asking for. If you're going for OTC, this document has to scream safe for self-medication. Next up, the Patient Information Leaflet, the PIL, and the product labeling. Okay, now your audience has totally changed. You're not talking to doctors anymore, you're talking directly to patients. Is the language simple enough for your own grandmother to understand without getting confused? Does it clearly protect them from any potential dangers? For any OTC application, these documents aren't just a formality. They are core pieces of your safety argument. And hey, don't just take my word for it. The SFDA says it themselves right in their guideline. They state that for an OTC proposal, the labeling and leaflet are important elements of the application and will be closely examined. So they're literally telling you up front, we are going to scrutinize this, so you better get it right. So, after all that, what's the one thing you should walk away with? It's this. Product classification in Saudi Arabia is not a marketing decision. It is a safety decision, pure and simple, and it's governed by a very strict, evidence-first framework. Your job is to build a dossier so strong that it leaves no doubt that your proposal is the correct one, and most importantly, the safest one for patients. And that leaves us with one final thought. As you get your next submission ready for the Saudi market, take another look at this framework. Have you really built the right regulatory case? A case that's not just aiming for approval, but one that is designed to safely unlock your medicine's absolute full potential in the kingdom.